Yellowjack caused unprecedented levels of damage, leaving a trail of devastation in its wake. The virus's rapid transmission and high infection rate overwhelmed healthcare systems globally, leading to widespread panic and societal disruption. Entire cities were quarantined, economies faltered under the weight of medical emergencies, and the death toll climbed as medical treatments proved largely ineffective against the virus's adaptability. The infection had a multifaceted impact. Physically, infected individuals experienced severe symptoms ranging from high fevers and respiratory failure to neurological issues, depending on the strain. Psychologically, the fear and uncertainty surrounding Yellowjack caused widespread anxiety and depression. Socially, communities were fractured due to enforced isolation and distrust among individuals suspected of carrying the virus. Economically, industries such as travel, manufacturing, and retail faced severe downturns, while governments struggled to allocate resources for emergency response. The environmental toll was also significant. Discarded medical waste, including protective equipment and unused experimental treatments, contributed to pollution. The prioritization of pandemic response efforts also led to the neglect of other critical issues, such as climate change and infrastructure maintenance. The outbreak of Yellowjack caused widespread devastation, impacting every facet of society. Its rapid transmission overwhelmed healthcare systems, leaving hospitals understaffed and under-resourced. Entire cities were placed under quarantine, and governments implemented strict lockdowns to curb the virus's spread. Economies suffered as industries like travel, manufacturing, and retail were paralyzed, while the global workforce faced unprecedented disruptions. For individuals, Yellowjack brought severe physical and psychological effects. Infected people experienced debilitating symptoms such as high fever, respiratory failure, and neurological damage, with many succumbing due to a lack of effective treatment. On a societal level, fear and uncertainty fractured communities. Isolation measures and mistrust of those suspected to be carriers eroded social bonds, leading to widespread anxiety and depression. Environmentally, the response to the virus left a significant footprint. The use of disposable protective equipment and experimental treatment waste contributed to pollution, while the prioritization of pandemic management diverted attention from other critical global challenges, such as climate change and infrastructure development. Preventing Yellowjack or a similar pandemic requires comprehensive and proactive measures. Strengthened biosecurity in research facilities is essential to prevent accidental releases of dangerous pathogens. This involves implementing strict containment measures, conducting regular audits, and adhering to international safety standards. Global surveillance systems must be established to monitor and detect emerging threats early. Coordinated international reporting and real-time data sharing can help identify and contain viruses before they become unmanageable. Public education also plays a crucial role in prevention. Teaching hygiene practices, such as proper handwashing and the use of masks, can significantly reduce transmission. Clear and accurate communication from authorities is vital to prevent misinformation and maintain public trust. Investing in healthcare infrastructure is another critical component. Building capacity for hospitals, training healthcare workers, and ensuring the availability of medical equipment like ventilators are essential for managing future outbreaks. At the same time, advancing scientific research to develop broad-spectrum antivirals and adaptive vaccines ensures that effective treatments can be deployed quickly. International cooperation is key to addressing global health crises. Nations must work together to coordinate resources, fund research, and enforce policies that minimize the risk of pandemics. Ethical oversight of high-risk research, particularly experiments involving gain-of-function studies, is necessary to ensure that scientific advancements do not inadvertently create new threats. By combining robust preparedness measures, technological innovation, and global solidarity, humanity can mitigate the risks of devastating pandemics like Yellowjack and protect future generations. Yellowjack remains a significant global health concern, with its impact still being felt across various regions. Although initial outbreaks have been contained in some areas through quarantine measures and strict public health interventions, sporadic cases and localized outbreaks continue to occur. The virus's high mutation rate has resulted in the emergence of new variants, making it more challenging to develop universal treatments or vaccines. Healthcare systems in many countries are still grappling with the aftermath of the pandemic. Resources are strained as medical professionals manage both lingering cases and the long-term effects on survivors, such as chronic respiratory or neurological conditions. Economically, many sectors are slowly recovering, but the disruption caused by the virus has left lasting scars, particularly in vulnerable communities. Global efforts are ongoing to monitor and combat yellowjack. Scientists are working to understand its mutations and develop broader-spectrum treatments. International organizations are coordinating surveillance and response efforts to prevent further spread, but challenges remain, particularly in regions with limited healthcare infrastructure and political instability. Preventing the resurgence of yellowjack or future pandemics requires a multifaceted approach that combines scientific, public health, and policy-driven measures. Strengthening global surveillance systems is critical to identifying and responding to outbreaks early. This includes real-time data sharing, international cooperation, and building robust monitoring networks. Biosecurity in research facilities must be a priority to prevent accidental release of pathogens. Strict containment measures, regular audits, and compliance with international standards can minimize risks associated with high-stakes research. Ethical guidelines and oversight of gain-of-function experiments are also essential to balance scientific progress with safety concerns. Public education remains a cornerstone of prevention. Promoting hygiene practices like regular hand-washing, mask usage, and respiratory etiquette can significantly reduce the risk of transmission. Clear and transparent communication from authorities is vital to maintaining public trust and ensuring adherence to safety measures. Investing in healthcare infrastructure is crucial to managing outbreaks effectively. Increasing hospital capacity, training medical personnel, and stockpiling essential medical supplies can enhance preparedness. Accelerating research into broad-spectrum antivirals and adaptable vaccine technologies is also critical for responding to emerging variants. International cooperation is key to a unified global response. Nations must collaborate to share resources, fund research, and establish equitable distribution systems for treatments and vaccines. Addressing disparities in healthcare access ensures that vulnerable populations are not left behind in pandemic prevention and response efforts. By prioritizing these measures, humanity can not only prevent the resurgence of yellowjack but also build resilience against future global health crises. Vigilance, innovation, and solidarity are the keys to safeguarding the world from such threats.